Chest tube setup, take 2. Okay, your baby's getting a chest tube. What do you need and who do you need? You need at least 2 nurses, one to assist the practitioner with the insertion and another one to set up the chest tube while the insertion is taking place. You also need a multi-purpose tray, a couple of available sizes of the Argyle catheters. We have 8, 10, and 12. Sterile gloves, steri strips, sutures, lidocaine, tegaderm, your atrium chamber, suction tubing, suction regulator that's functioning, and tape and safety pin to secure to the bed. So as they are inserting the chest tube, you or somebody will be setting up the chest tube chamber. It will come out of the package like this. You will get the sterile water to inject into the water seal chamber. Put that in there. And then you'll get your appropriate connector to attach to the chest tube. Whoever is sterile can attach all of this, which is also sterile and comes out just as so. Pretend I'm sterile. This connector will go in here, and this connector will go into the chest tube, which has just been placed. And these sites will be secured with tape. Somebody will be holding this here while this is attached to suction on the wall. So you turn your suction on to anything greater than 80, and then your suction will go right in this port here. This is usually set at 20, but confirm with your practitioner where this will be. And then this is placed below the baby. To secure to the bed, our general practice is to use tape, which I can't find.
It's hanging on the elk cart.
Thank you. Take 3. And a safety pin. And secure this to a linen that's not going to be moved very frequently, and always be mindful of that when you are moving linens or moving the baby. If you are trying to remove air, if that's the purpose of your chest tube, removing air in a pneumothorax, you are going to place the affected side up when positioning the baby. And if you're trying to remove fluid, you will position baby with the dependent side down. At the bedside, you should one of your emergency equipment should always be a pneumo kit, which at minimum should have a 20 cc syringe, a stopcock, and a 23 gauge butterfly. This is a setup one. So if you do need this in an emergency, it's inserted, air is withdrawn, stopcock's turned, air is pushed out until you can't get air anymore. So this remains a closed system. Removal. Okay, supplies for removal.
Oh, maintenance checks.
Oh, maintenance checks. Sorry. So you will always be assessing the site. Every 4 hours, everything needs to be assessed. You'll assess what's coming out, assess the site, assess for air leaks. You'll see bubbling down there if there's air leaks. And at the end of every 12-hour shift, you will
Where do you see the bubbling?
You will see the bubbling right down here. This baby has a constant air leak right now. And you'll mark at the end of your 12-hour shift what fluid has come out.
And the volume.
The volume. When a chest tube is removed, it should always be covered with a Vaseline gauze, a 2x2, and a tegaderm. The chest tubes will always be removed by a practitioner or physician. And you will keep that emergency kit at the bedside after removal as well. That's it. You will always have your policy and procedure available on SharePoint if you need any references. Thank you.
Bye-bye.